Most of us are familiar with the standard hearing test. The patient listens to sounds through earphones hooked up to a relatively inexpensive audiometer and must react to the sounds either by lifting a finger or pressing a button. Now, with the assistance of advanced computer technology, there is a relatively new and promising technique gaining respect around the country. Called evoked response audiometry, its use was pioneered in the southeast United States by Dr. Pete Peterson, chief of auditory research at the Jackson Memorial Medical Center. With electrodes attached to the scalp and behind the ears, the patient lies very still in a usually darkened room as a series of clicks is piped in through an overhead speaker. Filtered brain signals, amplified at least 100,000 times, are fed into a computer in an adjoining room. Because stillness is so important, body movements are constantly monitored by an oscilloscope. When movement is detected, that portion of the test is thrown out. As the test progresses, a graph-like pattern of peaks and valleys emerges on the computer screen. Calculating the time delays between the audio clicks and these peaks, then comparing them to a so-called normal graph shows whatever hearing loss, if any, is present.
The most important thing is that it does not require the cooperation of the patient. That is, if we have an infant who is suspected of having a hearing loss, but behavioral tests are unable to definitively state that the child or that the infant has a hearing deficit, this test can be used because it doesn't need patient cooperation.
While evoked response audiometry can also detect neurological disorders, Dr. Peterson predicts its biggest future use will be as a screening process for infants who may have hearing problems. Because the technology is still expensive, private use is probably a long way off. But Dr. Peterson believes most medical centers will be using the process within a year. Bob Mayer, Channel 4 News.